Club business, I'll go ahead and introduce our speaker today. I'm very happy to have Dr. Gullone join us to discuss how COVID has impacted his family's practice at Midwest Health Clinic. Dr. Gullone joined Midwest Health Clinic on August 3rd of 2009, along with his wife, Dr. Beth Gullone. We are so fortunate to have Dr. Matt and Beth not only practicing at Midwest Health Clinic, but also in our community. They have just been a great addition. So Dr. Gullone.
All right. Can everybody hear? Can everybody hear me? Okay, if I stop.
No, that microphone is for the people on Zoom. The one in your hand.
So we're going to talk a little bit about how COVID has affected family practice in general. If you have any questions, just hold it for the end. Feel free to answer. So probably the biggest thing that I've noticed, like as a practitioner, is when they teach you how to, when you're taught how to do medicine, you have to think like acuity level, like who's sick, who needs the attention first. And probably the thing with COVID is, 10 months ago, if you said you had sniffles and a cough, I would say, hey, you have a cold, you're good. Now all of a sudden, that kind of changes what you have, because that can lead to COVID. And the problem with COVID is it starts with the sniffles and a cold, and generally that happens on about day 4 or 5 that you were infected. The first 3 or 4 days, that's all it is, and then you start to get better on day 8, day 9, you jump off the cliff and get really sick really fast. So that's the one thing that probably sticks out the most. It changes how you think, which is really hard to do when you're 15 years old. And you just have to be more alert. And the way this spreads is probably more infectious than most things we've ever seen. They compare it to the flu a lot, and probably if we had enough testing, the death rate would be similar to the flu. But the way it spreads is, and when I say the flu, I mean influenza. It spreads way easier than influenza. There's some debate actually, like, will we actually see less influenza this year because people are wearing masks more, and that will reduce transmission of influenza, but we're not sure yet. So that's probably the thing that sticks out the most is you have to change the way you think, and you also have to take into account like the person that's calling for those symptoms, because it kind of determines, like, if they are a very healthy person, coronavirus likely isn't going to affect them very much. They'll get sick for a day. I had 3 friends get sick from it, all around my age, all had symptoms for a day, wouldn't have even thought about it otherwise in another year, but they were positive for coronavirus. My one friend was a pulmonologist, a lung doctor out in North Carolina. He was taking care of a lot of COVID patients. He walked out of the room, took his mask off, let the rubber band go, the mask snapped basically right in his face. 4 days later, he had fever. Only day he had fever, but he was positive for coronavirus. He was off work for, that was near the beginning, so I think he was off work for 16 days, living in an in-law's schoolhouse because his wife has an illness and he couldn't be around her. She has a lung illness. So it just changed everything. That was totally fine otherwise, but that's it, schoolhouse for 16 days. The other thing is that we're seeing now is an overall decrease in health. Like, people were locked down so long they didn't go out, their chronic medical conditions worsened, and when they would come into the hospital, they would be sicker. Some of them may have heart failure, waited much longer than normally do, and now maybe that heart failure requires hospitalization instead of just being able to be managed as an outpatient. That's just one example. That's probably the other thing. The thing we might see a couple years from now is missed or reduced screening tests, mammograms, colonoscopies, pap smears, things like that that can reduce cancer risk in the future. A lot of that was skipped, rightfully so. When they was locked down, they weren't essential visits, but now we have to make sure we get caught up and get everybody back on the regular screening schedule. So that was one thing we saw. The other thing with the worsening chronic conditions is we had to adjust how we see patients in the office. So we had to reduce our office visits. We make them longer so that patients get room with them for a longer period of time. But that way the waiting room can clear out and you don't have a big crowd waiting. You're not backed up. So it reduces availability to some extent. We also are seeing an increase in depression and anxiety. And it's a lot of, you're being cooped up, you're locked up, you can't do your normal things to get your stress out or your anxiety out, or related to work. A lot of people are laid off. That's another thing we're seeing. And those things are not easily remedied. They take treatment. Some of those can take a month or two to even set in. So we're seeing a lot in that. Those in and of themselves lead to people generally being sicker overall. So we haven't seen that uptick yet, but we may if this continues. One thing we didn't see that other parts of the country reported was an uptick in domestic violence. Now that could be good, and I even checked with the sheriff's department a couple times. They haven't had an increase in calls. So hopefully it's because it's not happening. The scary part about that is it's going to go unreported. So I'm hoping that's not the case. But so far we haven't seen it. Another thing in medicine is you're seeing increase in costs. We're using a lot more PPE. When I say that, personal protective equipment, gloves, masks, and then you're seeing less patients, you're doing less tests. So you have a decrease in revenue, so that's affecting the healthcare industry. The phone conversations about this have increased dramatically. One positive case is probably 15, 30 minutes on the phone, depending on patients' questions and symptoms and everything like that between us and the nursing staff, because having to explain to people how long they need to quarantine, what they need to do, who they need to contact, because typically you are infectious for 2 days prior to your symptoms. So you may develop symptoms on Monday before everyone you were around the weekend exposed to, and close contact. Explain that what that is to everyone. Within 6 feet for longer than 15 minutes total time in a day is considered a close contact. So basically, everyone you were around that definition of for the weekend, you would have to call, let them know you were positive. They may or may not need to get tested. So it's definitely something that it's a lot to explain, and it's really hard to get people that aren't sick to understand. The big thing with the coronavirus is that I'm not worried about getting coronavirus. I got it. I'm pretty healthy. I don't have any medical conditions. Biggest risk factor I have is I have type A blood, which is shown to have people have a forced reaction to it. But it's passing it on to people that are at risk. Anybody over 60 with any medical health conditions, they're at risk, especially diabetes, especially if you're overweight, COPD, lung issues, asthma. Passing it on to someone else is the risk for us. So that's probably the biggest thing that you have to worry about if you're healthy is who am I going to give it to that they're not going to be able to get from. Getting people to understand that is the hard part. The other part is it's confusing, especially when you live here, not necessarily Galena, but we are in the tri-state area. Iowa and Wisconsin do not have the same restrictions that we do. And it's unfortunate that you have 50 different ways to do this because we have 50 different states and no national guidelines. The CDC has recommendations, but there's no enforcement that they're all uniform throughout. For example, I had somebody that were in contact with a positive case and went to a gathering. It was like, you can't be here because it's only been 10 days. But they got their test in Dubuque, and they were told 10 days is okay. Always 14. So it's what they were told, but it's not the same as Illinois. I think the other thing we're going to see is right now we're in school, but we have a lot of kids that travel to Iowa, Wisconsin to do different sports. They're playing without masks. We're probably going to bring it back to our schools. So I hope that doesn't happen, but it's basically inevitable. And it's once again, it's probably not the kids that are playing sports that are going to get sick. It's the kids with asthma, teachers that are the ones that are at risk for that. Bus drivers do the thing. So it's hard to understand, especially when, you know, you can go across the river 15 minutes away and things are a lot different. So, and there's also different recommendations on who to test. So we have to kind of, and they differ even in Illinois, they differ among different people. So the most recent one I had is the application that's positive, and we were telling them quarantine, keep family quarantine for 14 days, and you know, your families probably already got it because they were around you all weekend, obviously. And then the health department calls and says, well, they all need to test for it. I don't agree with that because we were taught number one rule of the test is what are you going to do with the results? So in this case, nothing because they're already quarantined. So don't do the test. But you know, everybody, see health department, governor's office, they all have different recommendations. They test more, you're going to see more disease. But at the same time, is it going to change what you do? Not necessarily. So it's a lot of confusion, a lot of different things you got to take into consideration. You know, I haven't seen anyone that I diagnosed with COVID like in the office and was like, oh, you got COVID. Most of it's been over the phone. You know, come and get a test and you're positive. And so that's been good. You know, we've had very few cases. We've had people we need to transfer and things like that. So hopefully, you know, they're all doing well. But you know, I think our county is probably not at its peak yet. Probably going to get a little worse before it gets better. And then the next thing I think we're going to have to deal with is the vaccine. You know, there's different reports that they're going to fast track the vaccine, and people call asking about it. People inquire, and we see them, and we're not entirely sure about the vaccine is the answer because they're doing 2 huge studies right now, but they're going to take a couple months to know the results. Now, Dr. Fauci came on the other day and said if it's very positive results, they could stop the trial early. Yes, but still that going to take 8 to 12 weeks from when they start, minimum. And that's just going to show if you had a positive reaction to the positive reaction being good reaction. Sorry. If your body had a good reaction to the vaccine, then we may be able to fast track it. But you know, this November 1st, I think, is the earliest that they started August 1st. So yeah. That was why I said that. But then you have to think of distributing a vaccine to 300 million people, and then how many people are going to actually take it. And generally, I think 70 to 75% of the population have to take the vaccine to make it effective. So, I mean, that's going to be a chore. So you got to get 250 million vaccines to people and get them to take it. So, and then after you take it, maybe another 4 to 8 weeks before it's actually effective. So you're looking at January, the earliest that will have effective immunity against it. So this is going to be, it's going to be another couple of months, at least. Probably even another 3 to 4 weeks after that before we see a big drop. So it's a lot of different things. Hopefully it turns out okay, and I think it will. You know, vaccines have proven to be very effective in this stuff in the past. So hopefully that's what this is, and it's unfortunate that it is like coronavirus is just a common cold. Any other version you get of it except this one, and for even for 80% of people that get this one, it's a common cold, or you may not have symptoms at all. It's that 20% that they get sick. You know, 15% of those, and those people that you see the death rate of. When they get sick really fast. They probably go downhill in a period of 2 to 6 hours, maybe 8, and it's fast. And that doesn't sound like a long time, or it doesn't sound like a short period of time, but in medical, that's pretty quick. So, anybody have any questions?
Are you aware of any physicians in the tri-state area that if they're presented with a patient who is at risk and test positive, are treating them with some type of medication prior to respiratory collapse? I mean, these initial days, you know, there's a lot of talk about different types of medications that people can use. If it's early in the progression of the infection, that will more serious ramifications of respiratory collapse. I'm not sure medical, I mean, I'm talking, of course, about hydroxychloroquine, zinc, and Z-Pack or doxycycline. Are you aware of any physicians in the tri-state area that are using that treatment protocol, and have they had success with it?
So I'm aware of it, yes. I don't agree with it, nor do I think it's effective. There's actually evidence that hydroxychloroquine has negative effects.
Over a week's course of treatment?
Over
Over a week's course of treatment?
It could potentially cause cardiac arrhythmias, yes. They did a study in the VA, and it did. They actually had to stop the study early because people were having heart issues from it. So hydroxychloroquine is certainly not effective. Azithromycin has also not been shown to be effective as the Z-Pack. Azithromycin is an antibacterial agent that could possibly have antiviral properties, which is what the coronavirus is, the virus. So it has not been shown in any randomized double-blind placebo-controlled trial that it helps at all. And you would think by now that it does. Initially, they were using it because they don't have anything else. Now they're generally pushing toward more steroids. Dexamethasone is a big one. And that's been shown to decrease mortality with no pre-treatments. The initial hydroxychloroquine study, was some guy I think he was in New York, that gave it to 26 patients that he treated. He gave hydroxychloroquine and azithromycin, and said, "Oh look, 25 of them got better," which 25 of 26 did get better. Surprisingly, that's 4% death rate, which is actually higher than what the coronavirus is. So it's not really a study. It was one guy that did it to a generally healthy population. So it's not really an actual study, even though the control groups. That was a big one that was touted as a early treatment for it.
It's my understanding that a lot of the studies that have shown negative results tried this treatment after the patients were already seriously respiratory compromised. And I was wondering, are you aware of any studies that were done where the medicine was given earlier in the infection?
So I believe the VA study was earlier in the infection to the point where they had to stop it because more people had cardiac issues than actually got better. So that one I believe it was. I'm not entirely sure, but yes. So the azithromycin, I'm not aware of any, but there haven't been any to show it helps. So
a lot of people have talked to this is hard one, of course, but why didn't we take up an approach as herd immunity and let it rip instead of trying to control, flatten, all those things?
So that's a good question. So Sweden tried that. They had a pretty high death rate. I don't remember what their numbers are, but they did try that. So there's a catch to that. I understand that, especially. So the problem with herd immunity is you don't know, it's overwhelming the medical system at the very least. So if you let everyone get sick, and that was a problem like in New York at the beginning. It's not the fact that it's the number of people that are getting sick as fast as they were getting sick. The hospitals couldn't handle it. So you have to, remember I said that 20% of people are going to get ill from this and need treatment. You have to make that 20% last a long time. You can't have 20% get sick tomorrow because you can't handle it. Because the hospitals just don't have capacity for that. So by spreading it out, flattening the curve, you make that 20% more manageable. We don't have supplies to have enough ventilators, proper masks, and everything like that to get that 20% sick and then get it better and then just be done with it. That would be great, but it's just not. We don't have the capacity to do that.
That's what we're doing, isn't it? That's what we're doing, isn't it? I mean, it's slowly spreading through the population.
You mean by herd immunity like that? But
Yeah,
so, yes,
exactly. You would spread it out.
yes, spread out. That's what
We're
you want to
doing.
do. Correct. Correct. That's what you want to do because you just don't have the capacity and enough equipment to treat everyone all at once. And so if you don't have that, then that 1% of people that were going to die, they were going to die anyway. It's that catching that other portion of the population that wasn't going to die with proper treatment. You have to be able to get them the proper treatment to keep them alive. If you have that overwhelming capacity, you can take a good guess who's going to be the sickest people, but there's no way to know who's going to get sick and who I need to put on that, and what don't.
Where are they at right now?
With their numbers, I don't remember the percentages. Yeah, I don't know what they are. Last time I looked, that was maybe like a month ago. But, you know, it's all, the new advisor, the medical doctor that's in the White House right now, he's a neuroradiologist. Which basically means he looks at brain pictures all day and has for the last 20 years. He's never dealt with infectious disease. So he's pushing for immunity right now. He's probably not the best person to listen to. Probably, yeah. Yeah.
Hey, Matt, I saw somewhere the statistic was if the vaccine became available, only 50% of people would take it. What's going to take it? If one's available, and I mean, I'm signing up for it. Maybe not the first guy, but I want to be the last one.
So that's yeah, when I said saw 60%, yes, we would take it. So that's the problem. That's the problem. You're still going to have a vulnerable population. So it looks at it from a medical standpoint, you still have that vulnerable part of the population, that 40% that's going to spread it, and is it going to still overwhelm the system? You know, in my opinion, if there's a vaccine available and you don't want to take it, then good luck to you. Like, that's your choice. It's fine. I'm okay with that, but like, don't be surprised if you're sick. Could be the other thing. So that's, yeah, it's going to be a problem, but at the same time, if you have a treatment for something, you're not willing to take it, like for prevention, you know, that's kind of a personal choice. You can't make anybody take it.
First of all, you gave me an exam, a rectal exam. You probably don't recognize me from this angle.
And that's yeah. This side better.
I know we're better. My question is, when this thing came out back in March, there was some talk of a multiple factor of unknown cases. It was anywhere from 10 to 50. Is that line of thought still correct? Is there a multiple out there that say 10?
Are you talking unknown cases like there might be 10 times the number of people that actually have it than we test for? Oh, yeah. I don't know what that number could be. I mean, I would assume it's way up there. They've done 2 different studies on different coasts. One was in LA and the other was Boston, I think. Where basically like they did the antibody stuff, and the antibody test looks for if you had the infection, not that you have the infection. So it looks like it has to be at least 4 weeks from when you were sick. And it was like 9 times the amount, 9 or 10 times the amount of people that thought that were initially positive actually had it in the community. So it's way higher than we know, which is which makes sense because most people are fine because they have sniffles.
I want to thank you for being very honest with us. I like everything that you had to say. I've been watching this thing religiously, and I agree with everything you've said. I think the problem that I have in the population, is the goalposts keep moving. Keep moving the damn goalposts. When you said earlier that you wanted to flatten the curve, that was the original intent. Well, last week, there was 14,000 beds in Illinois dedicated to COVID-19 patients that are empty. Nobody in them. There's only 1,500 patients in COVID hospitals in the entire damn state. You know, yesterday, 11 people died in the state. On Monday, it was 7. What the hell are we doing with this destructive shutdown, semi-shutdown, and threats? When I don't, this thing is, to me, it's overblown at this point. I don't know, maybe if it gets out of hand again, you've got to put a squeeze in it or something. I think that's the real frustration at this population.
I would agree, and I agree with that. The problem was there was no central plan at the beginning. It was kind of like liken it to if you had a manhunt in Joe Davis County, and you had the sheriff's department and all the surrounding police departments all doing their own thing to find this one guy instead of communicating to each other. It's not going to work as well. Whereas if you have one central command, saying everybody do this, you're going to take this part, you're going to do this, this, and this. Instead, we had 50 states and like everybody go buy their own ventilators. Well, you just started a 50-state bidding war for ventilators. That's should listen to that too, but we didn't. So, I mean, it is what it is now, but, you know, that's water under the bridge. Unfortunately, and it's probably going to continue like that. Like, should we start to lighten things up? You can, and I think we should to a certain degree, but at the same time, like, what are we going to do when if it spikes again?
You know, the thing is that over the past 25 years ago, the federal government has lied to the population so many times to advance an agenda or whatever, going from invading Iraq to whatever they do, you know, I mean, it's just not very credible. I mean, so if you talk about a central authority like Fauci, he's not going to be believed by a lot of people, especially if he has associated, you know, financial arrangements with vaccine companies or is funded by Bill Gates Foundation. I mean, a lot of people say, hey, wait a second, I don't believe this guy. So, and they haven't earned trust. So what are you going to do?
Once again, they don't have to believe me. That's okay with me, but he probably should listen. Like, you know, I don't tell my mechanic what's wrong with my car because I don't know anything about a car. So I probably wouldn't tell Dr. Fauci what to do with the infection.
It's about trust.
Well, it's the same thing. Yeah. And I know my
You got to take
mechanic.
a real leap of faith.
So. It's me.
One more question.
Yeah.
Looking at the speeding ticket, we're talking, you've only been in the newspaper. How come people that have COVID-19 are not mentioned so that we know we have met this person or not?
So that's what we call HIPAA, privacy issue.
Well, how about the ticket?
Well, I don't know all the legal mumbo jumbo to go with that, but when you get a ticket, you can fight it in court, which is a public record. So no, I would say no.
Wouldn't it be beneficial to the rest of the population? No.
Well,
So you know if you met the person or not?
not necessarily, because maybe that person will get a lot of harassment or phone calls telling them they're an healthy person for being out when they have it, or things like that. And we have seen that actually. So.
Well, yeah, we have taken the red stuff.
Yeah, when you get COVID, I'll be glad to put that.
I mean,
I'll put my name in there when I have.
the health department does do something called contact tracing, which Tracy just brought up. So they do contact people that are positive and tell them that they need to contact everyone they were in contact with. So that's about as good as we get. So.
Do you know anything about those procedures when they do the contact tracing?
Not a whole lot. Like I can tell you from my friends that have had it, like they had to call everyone if they were in contact that they remember being in contact with.
Our health department actually contacts you, so it's not necessarily the person that's positive that will contact you. The health department will actually contact you and tell you what you need to do. They'll actually also receive a letter in the mail, because a lot of times employers want to see something for a future going in and staying, so they'll actually follow up with a letter. And then there is a communication that the health department is sending out. So once they've been in contact with you, they will send you a text daily to make sure that you're quarantining. And of those that have been contacted, only about 50% reply to the text messages. So Sandra doesn't know if that means only 50% are following directions or just 50% choose not to respond. Yeah, that they've been contacted, they've received a letter, and then every day they'll get a text that they should just confirm that they're still feeling okay and they're staying in and following the direction that they've been provided, but only 50% of the people will actually respond to that. Because they've been in direct contact with somebody else. Yeah, because they actually have been hiring people to do this now. The problem was they didn't have staff initially. So.
Yeah. So one trial is a dual dose 4 weeks apart. The other one is a single. I want to say 5 weeks is a single. So if you're interested in the vaccine trials, you can actually go to a website and register for them. I did it myself. But they're only really trialing it on high risk people. So when they ask me all the questions like, do you wear a mask or do you have some blood? Yeah, basically, you're very low risk. So I'm not going to pick. Right, but they also want to make sure the vaccine works. So they gotta get the high risk people, as opposed to if I'm avoiding everything that's high risk, then. That's
That's my name in the paper.
so.
The question is, if you're doing this free testing, are people foolish for going and having a test at the time they're doing it? If they're active in their work and active in people?
So the free testing, actually Harding won't test you unless you have symptoms.
Oh, I didn't see what that, there's certain things that they're doing.
Oh, they're gonna free test, I mean, you're not foolish for doing it.
Yeah.
I mean, it's reasonable if you're curious. So, I mean, once again, it's that question of what are you gonna do with the results? In this case, if you're gonna link to quarantine and go out of work for a couple weeks, then yeah, fine, go get tested. You're not gonna do any different with positive that you would negative, I wouldn't bother to get that. I've had 4, not pleasant. So, including UW Mass, and then went all the way back. That was all the way back.